There's an important conversation every man over 60 should have yet most never do. It's rarely brought up in doctors' offices and even less in casual chats between friends. But it's a conversation that can change lives. I'm Dr. Shant, a urologist with decades of experience treating men's health issues, and today I want to share with you 5 natural, accessible habits that can dramatically improve your prostate health. These are not myths or old wives' tales. They're backed by real science, proven through years of research, and have already helped thousands of men enjoy more freedom, less discomfort, and a better quality of life as they age. If you're over 60, or if you have a father, grandfather, husband, or close friend in that age group, this is essential knowledge. One of these 5 habits might surprise you, and it could make all the difference. But before we jump in, let's quickly understand why the prostate needs special attention after 60. Why the prostate matters more after 60. The prostate is a small gland about the size of a walnut, sitting just below the bladder and wrapped around the urethra, the tube that carries urine out of the body. It plays a vital role in producing part of the seminal fluid that helps transport sperm. As men age, especially after 50, the prostate naturally begins to enlarge. Even if the growth is benign, a condition called benign prostatic hyperplasia or BPH, it can cause serious urinary symptoms. According to the U.S. National Institutes of Health, more than half of men between 51 and 60 already show signs of BPH. After 70, that number jumps to over 80%. When the prostate grows, it squeezes the urethra, making it harder to urinate. This can lead to a weaker urine stream, the constant feeling that your bladder isn't empty, difficulty starting urination, and frequent nighttime trips to the bathroom. Here's the thing, many men think this is just a normal part of getting older. It's not. Science shows that simple daily habits can slow, stop, and even reverse some of these symptoms. And the first habit may seem simple, but it's more powerful than most realize. Habit 1. Strategic hydration. Hydration seems basic, but it's often misunderstood. The goal isn't just to drink water, it has to drink it the right way. As we age, our thirst signal weakens. Many men go hours without a sip of water, only to drink a lot at once when they're already dehydrated. This leads to concentrated, acidic urine filled with irritants that can inflame both the bladder and the prostate. Over time, this causes irritation, weakens urine flow, increases urgency, and triggers more nighttime bathroom trips. The fix? Strategic hydration. Drink water gradually throughout the morning and afternoon, and reduce intake in the 2 to 3 hours before bed. This approach keeps the bladder and prostate healthy, flushes out toxins, and helps you sleep through the night without multiple bathroom breaks. Studies have shown this method can cut nighttime urination by up to 40%, improving sleep quality and reducing inflammation. It costs nothing, yet it's one of the most effective changes you can make starting today. Habit 2. Light walking after meals. Another habit that gets overlooked is taking a short, light walk after major meals, lunch and dinner in particular. This isn't just about digestion. It's about improving blood circulation to the pelvic area and prostate. Walking increases oxygen and nutrient flow to the prostate, reducing inflammation and helping tissue stay healthy. It also helps control blood sugar, which matters because diabetes increases the risk of prostate enlargement and worsens urinary symptoms. Even just 10 to 15 minutes of gentle walking after meals can make a measurable difference. You don't need a treadmill or gym membership. Walking around the block, pacing the hallway, or even moving around the house is enough. Over time, this small, consistent habit can protect your prostate more than you might imagine. Habit 3. Maintain regular sexual activity. This topic is often avoided due to embarrassment or outdated beliefs, but medically speaking, it's one of the most powerful habits for prostate health. Regular ejaculation acts as a natural cleansing process for the prostate, flushing out built-up secretions, dead cells, and toxins. Research from Harvard followed more than 10,000 men for over 20 years and found that those who ejaculated at least 21 times per month had a 33% lower risk of developing prostate cancer. It also improves blood flow, relaxes muscles in the pelvic region, reduces stress, and boosts mood, all of which lower inflammation around the prostate. For men with concerns about sexual performance or frequency, the best step is to talk openly with a healthcare provider. Avoiding the subject doesn't protect you, but understanding and addressing it can safeguard your long-term health. Habit 4. Prostate healthy nutrition. What you eat daily directly affects prostate health. Certain foods are rich in compounds that fight inflammation and support healthy tissue. Lycopene, found in tomatoes, watermelon, and guava, is a powerful antioxidant proven to protect prostate cells. Cooked tomatoes twice a week have been linked to a significantly lower risk of prostate cancer. Zinc, abundant in pumpkin seeds, nuts, and seafood, helps regulate hormones and maintain prostate structure. Cruciferous vegetables like broccoli, cauliflower, and cabbage contain sulforaphanes that help detoxify the body and prevent abnormal cell changes. Aim for colorful, plant-based meals with a mix of vegetables, healthy seeds, lean proteins, and antioxidant-rich fruits. Think of food not just as fuel, but as daily preventive medicine for your prostate. Habit 5. Prioritize deep, restorative sleep. Sleep is often undervalued, but it plays a huge role in regulating hormones and reducing inflammation. During deep sleep, your body releases melatonin and growth hormone, both critical for protecting and repairing prostate tissue. Poor or interrupted sleep disrupts this cycle, raises stress hormones, lowers testosterone, and fuels inflammation. Studies show that men with chronic sleep disturbances are at significantly higher risk for aggressive prostate conditions. Create a sleep-friendly environment. Keep the bedroom dark and quiet, avoid screens before bed, and maintain a consistent bedtime. Deep, uninterrupted sleep isn't just about feeling rested, it is a nightly reset for your prostate. Final thoughts: these 5 habits, strategic hydration, post-meal walking, regular sexual activity, nutrient-rich eating, and deep sleep work together to protect and improve prostate health naturally. They don't require expensive treatments or drastic changes, just consistency and awareness. Start with one habit today and build from there. In a few months, you could notice fewer urinary symptoms, better energy, and an overall improvement in quality of life. Your prostate health is in your hands, and it is never too late to start taking action.